Heart disease is one of the top causes of death around the world. Most of the time, the symptoms show up in the chest or around the heart. But you know what? Sometimes the signs can pop up in other places, like your stomach, lungs, or even your ankles. Heart problems can lead to all sorts of serious health issues like blood vessel diseases that cause blockages or narrowing, like coronary artery disease or atherosclerosis. These can lead to heart attacks or strokes. Problems with the heart's muscle valves or rhythm, like valve issues, congenital heart defects, or arrhythmias. Usually, the classic sign of heart disease is chest pain or tightness. But here's the tricky part. Sometimes the symptoms don't seem related to the heart at all. This can make it hard to tell if you're dealing with a heart problem, which might delay getting the right treatment. So, how many of these signs and symptoms do you actually know? 11. Irregular heartbeat. A symptom you shouldn't ignore. It's not unusual for your heart to flutter, skip a beat, or speed up a little when you're feeling nervous, excited, or stressed. These occasional blips are typically harmless. However, if your heart races for hours on end, or you notice these irregular episodes happening frequently throughout the day, it could point to a more serious issue, an irregular heartbeat or arrhythmia. It can manifest in different ways. Some people feel like their heart is pounding or fluttering, while others experience it as a rapid or uneven pulse. One of the most common forms of arrhythmia is atrial fibrillation, AFib, where the upper chambers of the heart beat out of sync with the lower chambers. This condition can increase the risk of blood clots, stroke, and other serious heart problems if left untreated. While certain lifestyle factors like drinking too much caffeine, lack of sleep, or high levels of stress can sometimes trigger these irregular rhythms, persistent or severe cases are not something to dismiss. They may indicate an underlying heart condition that requires medical attention. Other symptoms that may accompany an irregular heartbeat include lightheadedness or dizziness, shortness of breath, chest pain or discomfort, fatigue or weakness. If you experience any of these symptoms, especially in combination with a racing or irregular heartbeat, it's critical to see a cardiologist as soon as possible. Early diagnosis and treatment can significantly reduce the risk of complications and help manage the condition effectively. 10. Swollen legs, feet, or ankles, a sign you shouldn't overlook. Swelling in your lower legs, feet, or ankles, also known as edema, can be more than just a temporary inconvenience. It could be a sign that your heart isn't functioning properly. When the heart struggles to pump blood efficiently, fluid can build up in your tissues, leading to noticeable swelling in these areas. This happens because poor heart function causes blood to pool in your veins, particularly in the lower extremities where gravity plays a role. Additionally, heart failure can impair the kidneys, making it harder for them to remove excess fluid and sodium from the body. These factors combined can lead to significant swelling that may worsen over time. You might notice puffiness around your ankles or feet, which could leave an indentation if pressed, a condition called pitting edema, swelling that extends upward into your calves or legs as the condition progresses. A feeling of heaviness or tightness in the affected areas. While edema can have other causes, like sitting for extended periods, pregnancy, or certain medications, persistent or worsening swelling, especially when paired with other symptoms such as shortness of breath, fatigue, or chest discomfort, should raise a red flag for potential heart issues. It's crucial to monitor your body for changes. If you notice swelling that develops quickly, becomes painful, or is accompanied by other symptoms, consult a doctor without delay. Early evaluation can help determine the cause and guide appropriate treatment, whether it's heart or due to another underlying issue. Remember, your body often gives subtle warnings. Don't ignore them. Timely action could prevent serious complications. Don't ignore what your heart is trying to tell you. Taking action could make all the difference. 9. A persistent cough. A potential warning sign of heart trouble. Most of the time, a chronic cough is linked to lung problems, like asthma, allergies, or chronic obstructive pulmonary disease, COPD. However, if you already have heart problems or are at risk for heart disease, A persistent cough could be your body's way of signaling that something is wrong. Pay extra attention if your cough worsens at night or when you lie flat, produces white or pink frothy mucus, which could indicate severe heart failure. This type of cough is often caused by pulmonary edema, a condition where fluid builds up in the lungs due to the heart's inability to pump blood efficiently. When the heart can't manage the flow of blood, it backs up into the lungs, causing difficulty breathing and this telltale cough. If you experience these symptoms, don't delay seeking medical attention. Pulmonary edema is a serious condition that requires urgent treatment. Left unchecked, it can lead to life-threatening complications. 8. Excessive sweating, a serious red flag. Sweating is a natural response to physical activity, heat, or stress, but breaking out in a cold sweat for no apparent reason can be a major warning sign of heart trouble. This type of sweating, often described as clammy and sudden, is the body's response to stress caused by reduced blood flow and oxygen levels. Excessive sweating is particularly concerning if it comes with other symptoms such as shortness of breath, chest pain or tightness, dizziness or nausea. These symptoms could signal a heart attack or another cardiac issue that needs immediate medical intervention. If you find yourself sweating excessively without a clear reason, it's crucial to act quickly. Call for help or head to the nearest hospital immediately. And don't drive yourself. Ask someone to take you or call emergency services. Sweating may seem like a small symptom, but combined with other signs, it can be an important clue that your heart needs urgent attention. Don't dismiss it as unimportant. Your life could depend on how quickly you respond. 7. Loud snoring. Could it be a sign of heart trouble? Occasional light snoring is normal and generally harmless. However, loud, disruptive snoring, especially when it's accompanied by gasping, choking, or pauses in breathing, could indicate sleep apnea, a serious condition where breathing repeatedly stops and starts during sleep. Sleep apnea not only disrupts your sleep but also puts significant strain on your heart. This condition reduces oxygen levels in the blood, forcing your heart to work harder. Over time, this added pressure can increase the risk of high blood pressure, atrial fibrillation, heart attacks, and strokes. If your partner has mentioned your loud snoring, or if you often wake up feeling tired or with a headache, it's time to take action. Doctors can conduct a sleep study to diagnose sleep apnea and may recommend treatments such as a CPAP machine, continuous positive airway pressure, to keep your airway open while you sleep. Addressing sleep apnea not only improves sleep quality, but also helps protect your heart health. 6. Nausea or stomach pain. Don't overlook these symptoms. It's easy to dismiss nausea, indigestion, or stomach pain as issues related to something you ate or mild stomach upset. But here's the thing. These symptoms can sometimes be early warning signs of a heart attack, particularly in women. During a heart attack, some people experience nausea, bloating, or stomach pain that can mimic gastrointestinal issues. In severe cases, this may even lead to uncontrollable vomiting. The overlap between stomach symptoms and heart conditions can make it tricky to differentiate, which is why awareness is key. If you frequently experience persistent nausea, recurring indigestion or heartburn, stomach discomfort, especially accompanied by other symptoms like fatigue, shortness of breath, or chest pain, don't hesitate to consult a doctor. It's better to rule out heart issues than risk ignoring a serious problem. 5. Sore throat or jaw pain, when it's more than a cold. Most of the time, a sore throat or jaw pain is harmless and caused by colds, sinus infections, or dental issues. But in some cases, these symptoms can signal a heart problem. Here's why. Pain from a heart condition, like angina or a heart attack, can radiate to the throat, jaw, or even the neck. This happens because the nerves in these areas are connected, and the brain can misinterpret the source of the pain. What's important to note is that this kind of pain often doesn't occur in isolation. It may come with other symptoms, like chest discomfort, shortness of breath, or fatigue. If you notice persistent or unexplained throat or jaw pain, especially if it lingers or worsens when exerting yourself. It's time to see a doctor. Acting early can help uncover and address potential heart issues before they become more serious. Your body gives you signals when something's not right. Loud snoring, nausea, and even throat or jaw pain can all be clues pointing to heart trouble. Listening to these signs and seeking medical advice promptly could save your life. 4. Dizziness, a potential warning sign of heart trouble. Everyone feels dizzy from time to time. It could be because you skipped a meal, didn't get enough sleep, or stood up too quickly. But dizziness shouldn't always be brushed off as harmless. It can also be an early warning sign of heart disease. When your heart isn't pumping blood efficiently, your brain may not get enough oxygen-rich blood, leading to lightheadedness, blurred vision, or even temporary loss of balance. This can happen suddenly, leaving you feeling off-kilter or weak. What's especially concerning is when dizziness occurs alongside other symptoms, such as, quote, shortness of breath, chest discomfort or pain, irregular heartbeat. If you experience a sudden, unexplained episode of dizziness, especially when paired with these symptoms, it could indicate a serious heart issue like arrhythmia, low blood pressure, or even heart failure. Don't ignore it. Consult your doctor right away. Early intervention can help uncover the root cause and prevent complications. 3. Pain that spreads to your arm, a classic warning sign. Pain radiating from your chest to your left arm is one of the most recognizable and classic signs of a heart problem, particularly during a heart attack. This type of pain occurs because the heart and arm share similar nerve pathways, and your brain can confuse the signals. The pain may start in your chest and move down the left arm, sometimes reaching as far as the fingers. It can feel like maha, a dull throbbing ache, a sharp, stabbing pain, a heavy or squeezing sensation. This symptom often comes with other heart attack warning signs, such as shortness of breath, nausea, dizziness, or cold sweats. Although it's more commonly associated with men, women can experience this too, but they may also have additional symptoms like fatigue or jaw pain. 2. Feeling too tired for everyday activities, a sign to take seriously. Suddenly feeling exhausted or short of breath after routine activities like climbing stairs, walking to the store, or carrying groceries can be a red flag for heart problems. This isn't just regular tiredness. It's a noticeable drop in your ability to perform everyday tasks without feeling wiped out. This symptom happens because your heart isn't able to pump blood efficiently, depriving your muscles and tissues of the oxygen they need. You may notice feeling winded after minimal exertion, needing to rest more frequently than usual, persistent fatigue that doesn't go away with rest. Interestingly, this symptom is often more common in women than in men and can be one of the earliest signs of heart disease. It's particularly concerning if it lasts for several days or worsens over time. 1. Chest pain, a warning you can't afford to ignore. When it comes to heart disease, chest pain is often the most well-known and significant warning sign. But here's the thing. Chest pain doesn't always feel the same for everyone. Some people describe it as a crushing or squeezing sensation, as if an immense weight is pressing on their chest. A burning or sharp pain that may radiate to other parts of the body, such as the arms, back, neck, or jaw. A dull, persistent ache, or a fleeting discomfort that comes and goes. What makes chest pain tricky is that it can strike any time, while you're active, at rest, or even asleep. Typically, the pain lasts a few minutes and may ease temporarily with rest or medication like nitroglycerin. However, if the pain is severe, persistent, or accompanied by other symptoms like shortness of breath, nausea, or sweating, it could indicate a heart attack or another serious heart condition. It's also important to note that not all heart problems cause chest pain. Conditions like silent heart attacks, more common in women and individuals with diabetes, might present with symptoms such as fatigue, dizziness, or discomfort in other areas like the upper back or stomach. Your heart is at the center of everything you do, and paying attention to its signals could save your life. From chest pain and arm discomfort to seemingly unrelated symptoms like dizziness or fatigue, every sign matters. Recognizing these warning signs early and seeking timely medical attention can make all the difference in preventing serious complications. Remember, heart disease doesn't always come with obvious warnings, so being informed and proactive is key. Regular checkups, a healthy lifestyle, and knowing when to act are all steps toward keeping your heart strong and healthy. If you found this information helpful, make sure to like this video and subscribe to our channel for more tips on health and wellness. Share this with friends and family. It might just save a life. Stay informed, stay healthy, and we'll see you in the next video.